Good evening, friends. I'm Dr. Saroj Kumar Sahoo, acting as an intervention cardiologist in BS Healthcare at Kurukshetra, Haryana. So today I'll talk the basics of heart attacks and understanding of basically heart attacks and preventions. So on World Heart Day, the objective of this today's talk is to understand about heart attack and its causes and how to prevent heart attacks. So nowadays, incidence of heart attacks and number of deaths due to it are consistently increasing in India. So we need to understand how a heart attack happens, what the reason behind it, heart attack, and how can we prevent it. So heart is the most essential organs and it's functioning non-stop throughout our life, and it's very crucial for our survival. Its function is pump and allows the circulations of blood throughout the body. So any interruptions of blood supply to heart through it blockage in the blood vessels can cause impairment of heart functions, and that leads to heart attacks. We commonly cause myocardial infarctions. So the main reason behind heart attacks, the gradually in current scenario in India, the increasing by day due to increase in poor lifestyles and poor diet habits and lack of physical activities and particularly stress factors in current post-pandemic periods. So the common risk factors of heart attacks, we know the hypertensions, diabetes, hypercholesterolemia, and sedentary lifestyles, obesities, smokings, and the family history of heart attacks. So the main topics, main reason on the World Heart Day, we know how to prevent it by adapting a good lifestyles, by adapting good dietary habits, and by doing regular physical activities, and most importantly, by decreasing the stress levels. Particularly, we should have proper sleep, and obviously, we need to stop courtesing smokings. So heart attacks can happen to any individuals, and the most common symptoms in a persons can have in heart attacks, that is heaviness or squeezing in the chest, and it's mostly related to the both arms, neck, jaw, and backs. And few patients had symptoms of dizziness, fainting, or lightheadedness during heart attacks. And obviously, most patients having major heart attack, they can have a shortness of breath, and of few patients have a complaint of nausea, indigestions, and vomitings. So the most important factors in reducing prevention of heart attacks is diet. So we need to adapt a good dietary habits. We need to emphasize the increased intake of fruits, vegetables, whole grains, poultry, and we need to decrease the intake of red meat, particularly the currently available in markets, that is sugar beverages, and particularly sodas, which have high calorie contents. We need to increase the dietary fiber intakes by increasing intake of fresh vegetables and fruits. And the most important is that the bad cholesterol level, that is saturated fat. So the food content which had high content of saturated fat, we need to decrease that intake of food. And most important in dietary habit is the salt, where is particularly hypertensive patients. We need to limit the intake of salt intake in all patients, irrespective of blood pressures. And particularly in patients having hypertension, we need to decrease the intake of sodium, and particularly it should be less than 1,500 per day, milligram per day. And the second most important factor in prevention of heart attack is exercise. And we need to maintain a good ideal body weight. And we need to do regular physical activities, particularly aerobic activities. And the exercise particularly increase the good cholesterol level SDL and decrease the bad cholesterol level, particularly LDLs. And we need to specifically quit smokings, and we need to limit the alcohol intakes. And lastly, another list of stress. So the stress is the most important factors in current scenario, that is post-pandemic periods in India and all of the world. It's a very really important risk factors in heart attacks. So the managing stress and getting adequate sleeps very important prevention of heart attacks. Thank you. Stay healthy and stay safe.